All right. Well, hello, everybody. Welcome. My name is Carolina, and I'm a career advisor in the Experiential Learning Hub at the University of Guelph. I work closely with students from the Ontario Agricultural College. Today, we're continuing with a series of career spotlights that we have begun in our department over the last academic year. We're exploring various careers available to students after graduation through videotaped interviews with professionals who work in a lot of these roles. So today, thank you very much. We're going to welcome Dr. Kate Armstrong. Thank you for being here with us today.
Oh, thank you for having me.
Dr. Kate is a licensed veterinarian and owner and practitioner at Still Moving Osteopathy. She had graduated from OBC in 1999. She immediately became an owner in a mixed animal practice with large animal mobiles and 2 small animal hospitals. Over her career as a veterinarian, she worked with many species, including exotics, and in a search for something more, she qualified as a certified veterinary acupuncturist. Over time, Dr. Armstrong began to look again for a more effective way to bring health back to populations, which led to her enrollment at the Canadian Academy of Osteopathy. There, she completed a 4-year program in human osteopathy, earning her designation of Master in Practice of Osteopathic Manipulative Sciences. Dr. Armstrong currently practices in Barrie, Ontario, and her practice is split evenly between human and animal populations. In addition to clinical practice, she's the professor of anatomy at the Canadian Academy of Osteopathy, where she teaches anatomy and palpation. She's also teaching the graduate diploma in animal osteopathy. So thank you again, Kate, for being here today. And I look forward to getting the conversation started and everybody learning from such a diverse background and from your perspectives on all of the things that you have gone through in your career path. So to get started with the conversation, I want to talk about the fact that your career path has had so many twists and turns. So can you tell us a little bit more about that? What led you from primarily practicing veterinary medicine to practicing animal osteopathy?
Yeah, it was a very twisted and turned kind of journey, as you say, because I had this great intent that I was going to go into veterinary medicine and I was going to, just do a great job of helping animals, helping people. It was going to be what I wanted. And there's a point in every career, I think, not just in veterinary medicine, where for the first 3 years you don't really know 100% what you're doing. Don't tell anyone. But you have that feeling that you're not quite competent, right? Because you're new in your career. And what we discover over time is that we develop competency in our careers, and this happens with vets. And then about 7 years out, you get this kind of, well, is this it? Right? Because you know now maybe what you don't know. There's more out there. And so you don't really, you reach this almost crisis in your career. And this happens to a lot of people where they'll go back to do a specialty or they'll even change careers at this point. And I knew there was something I was missing and I wasn't sure what it was. So I went off on a tangent and looked at, getting an MBA, but that didn't really do it. So I had to come back to, what relates to practice and what I truly want. And that's what led me to acupuncture. And I think what I was seeking was something that didn't rely on symptomatic therapy, even though we say in allopathic medicine that we're healing a disease or helping an animal or a human for that matter get past an illness. We're really dealing with symptoms until the inherent ability of the animal takes over and heals itself. We're depending on homeostasis. We're supporting it. And I thought there's got to be a better way to do this. And certainly acupuncture and traditional Chinese veterinary medicine kind of integrated into typical Western medicine seemed to be a stepping stone, but it really wasn't it. And I finally decided to look at osteopathy, both from a human perspective, because I had suffered an injury and it had helped me significantly. And I saw what it did for me. And I thought, how could this apply? How could I use this going forward? And I really initially thought, I'm changing to human medicine. Or to human care. That's a little bit of an interesting turn because there was a little more than just seeking information or seeking that thing that I'm missing that gave me impetus to change careers. And veterinary medicine has changed a lot since I graduated 20 years ago. There's certainly been advances in veterinary medicine. We can do amazing things. We have a lot more science available to us. We have a lot more resources available. But unfortunately, our clients have changed a little bit in how they view veterinary medicine. When I graduated, veterinarians were viewed as being an authority in their field. They were a source of information that was trusted and that was relied on by the community, whether it was agricultural or companion, didn't matter. You were speaking from a place of knowledge, and you were respected for that, which was great. Unfortunately, as the years went by, particularly in the last 10 years, that view has changed. And people come in now who are more inclined to be abusive towards veterinarians and veterinary staff. Yes, they're under duress. Nobody's going to the vet because they want to. They're always there for not a good reason, right? They're not coming just to say hi. So they're under emotional duress, but unfortunately that spills over into some behavioral components with their caregiver. And so we saw a real change over time from veterinarians being, respected for their professional opinion to being abused for their professional opinion. And there was always those 2 out of 10 clients who would come in who were either verbally abusive, either to myself or staff. They would pull things like, oh, you're only doing this for money. If you cared about animals, you do this for free. So this is really emotional abuse over time. And it's not a big deal once, but imagine facing that several times a day over years, right? So this is one of the reasons that veterinary medicine has changed. And we now are top of the list in suicide and mental health issues in veterinary medicine, which is a really sad place to be. Because this is a helping profession. So all the people who are in veterinary medicine want to help people, want to make lives better, and it's not happening in a way that's conducive to mental health on both sides. So there was a little bit of fatigue, shall we say, for me in the profession. And I become a little bit cynical and a little bit jaded. So that's not a good place to be, because you're not effective in your profession when you're like that. So I thought, how can I still do what I want to do, which is essentially help people, help animals, and be effective in that measure, right? So that's a big piece for me to make that shift.
Yeah, I think it's interesting in some of what you said about veterinary medicine with regards to being a helping professional through that, and some of the ways that the clients respond. I think, like, being a helping professional myself, in a lot of these types of careers, there's this idea that we are almost immune to all of that, right? All of that criticism, all of those comments that we, for some reason, we should just be able to handle it all the time, and all the criticism. So thank you for sharing that, on behalf of all of us helping professionals, that does get to us, right? And that it can be difficult, those types of comments and so forth. Can you explain a little bit about osteopathy, though, as a therapy, and what that actually means? Then how is it different? How does it make it different from other therapies that are out there?
Yeah, well, osteopathy is a hands-on profession. So it is a hands-on therapy or modality. It was, shall we say, discovered or developed in the late 1800s in the US by a gentleman called Andrew Taylor Still. And he was a medical professional of his time, which meant that there wasn't a whole lot of medicine going on, right? They were still using mercury, they were still using bleeding. I guess there was more opium around, so laudanum was a thing. So pretty crude, especially in the American frontier, right? There wasn't a lot of resources. He became really, really frustrated with the medicine of his time and the fact that he couldn't help people. So one of the things that he noticed, because he was a keen observer, funny enough, of wildlife, and animal life. So he actually took a lot of what he saw from nature, and he noted that when structure, meaning the anatomy of an animal, was functioning the way it should, those animals did well. And he started to consider this on the human side. What does structure and function actually mean? How does anatomic integrity affect homeostasis and ability to self-heal and self-regulate and health? And he started to play around with it. He started to look at manipulation of the anatomy. He had a few breakthrough moments where he noted in a client she was very, very ill, and just by palpation he realized that her ribs didn't really feel right, and he managed to coax them back into place, and she suddenly had an ability to breathe better and no pain. So he's like, oh, okay, structure and function. So over years he developed this method of manipulation called osteopathy. Unlike massage or chiropractic, it handles all layers of tissue. Chiropractic tends to think about nerves and therefore spine. They'll deal with bones in general, but there's a lot of jarring stuff in chiropractic, like those high velocity, low amplitude moments that cause you to crack suddenly, the ones that make take your breath away a little bit. I'm not great at undergoing cracking, so I'm like, oh, every time I think about it. And massage feels good, but it doesn't necessarily stick with you. So osteopathy actually allows you to manipulate all layers of tissue, whether they're superficial, like fascia and skin, or whether we're talking about the neuromuscular layer, or whether we're talking about the deep articular layer, which refers to bones and ligaments. We can actually manipulate all of those in a surprisingly gentle fashion. So we're not doing anything big and quick. There's no sudden wax cracks or bangs going on. Some people are kind of surprised after their treatment. They're like, that was it? It's like, yeah, that was it. And then the next day they're like, oh my gosh, that was it. That was really amazing. So it's interesting to see the responses in people. Animals are incredibly pure in their response to osteopathy. There is no making it up. People can have the placebo effect. It's like, oh yeah, that felt great. I feel good, and off we go. Animals, it works or it doesn't. So they are the best critic of your work. If it does nothing, trust me, it'll do nothing. So I think part of it for animals is the fact that they have a much better ability to let the other stuff go. They are not worrying about when they have to pick up the kids or whether they did a good job in their, at work today. They have none of that mental stuff. Don't get me wrong, animals do have mental stress and mental anguish, but it's different than ours, I think. I don't think they dwell the way we do. So they're a little easier to work with. Yeah.
That's super interesting. I've never thought about that with regards to, the animals and how pure they are in their response to it. And as you mentioned, either it works or it doesn't. It's really clear from the way the animal behaves, right? Yeah, it's very interesting. Thank you.
I like to think of them as actually being quality control for my human side.
Yeah.
Because if I'm not able to get it done with an animal, I'm not going to get it done with a human, right? So yeah, they're very good at making sure I do a better job with humans.
Yeah.
Yeah.
So how does one go about becoming an osteopath? What is the pathway?
Well, definitely you want to look at a school that is going to teach you what you need, and keep in mind I have somewhat of a bias because I think the school I went to really did a good job for me. And there's two types of schools out there. There's what we call a type 1 and a type 2 school. A type 2 is one that takes somebody who's, say, a massage therapist, a physiotherapist, has some kind of background, kinesiologist, and they train you technical applications to meld into your current practice. So they do teach osteopathic techniques. So that's a type 2 school. The school I went to in Hamilton is a type 1, which means we're taking people who have no background and training them from the ground up. So we're what's called a principles-based school. While you will learn technical applications, you also learn the idea of how to apply the anatomy to itself. So you understand how to connect a leg to a back and how to connect a head to your sacrum because of the anatomic structural connections. And that is a really marvelous way to learn because it opens up this infinite ability to either create technical applications on the fly as you need them or to treat someone in any position. And doing this really wakes up your hands as well. So all of a sudden your hands become this wonderful testing tool. You train the neurology of touch. Think about someone who can read Braille. They can, they've got that sensitivity in their fingers through long years of practice. going through the human program really gives you that sensitivity. As a veterinarian, I thought I had really good palpation skills. I mean, after 20 years, you'd think so. Well, there were nothing compared to what they are now. I swear I'm like the princess and the pea. I can feel anything through anything now. It's kind of shocking. But from there, once you get that designation as an osteopathic manual practitioner, you can then go on to complete a course in animal osteopathy, which really just builds on the human concepts, adds in animal anatomy in all species, by the way. And we also introduce some of the ideas of how the physical structure of the animal, because they're quadruped, it changes some of the dynamics and the mechanics in the body. So we spend a bit of time talking about that, and of course, being hands-on as well. So ultimately, it's 4 years to get your human practitioner component, and then an additional year for your animal. But it's well worth it because you just end up with this wealth of information, and it broadens your horizons, and it kind of makes you a little more resilient in the marketplace because you have so many places that you can work.
And is that a 4-year undergrad or is that after university?
We look at it as a 4 year after university. However, let me just put a qualifier on that. You don't necessarily have to have a kinesiology degree or a science degree or any degree to go through the program. There are people who are switching from alternate careers. So we've got right now some of our students actually work in labor, like they're construction. Right. So if you've got an aptitude, the chances are that you can get into the program. There is a process to go through and an interview process as well. So technically you could do it right out of high school.
All right. Thank you.
Yeah, you're welcome.
So I think you've answered my next question. I was going to ask you if being a veterinarian was a requirement to be successful in animal osteopathy. What's your take on, has that helped you? Is it necessary?
I think has made a great difference for me personally, because I believe that every piece of education that you have in your lifetime, whether it's the right path or the wrong path for you, I think it informs your future, and it changes your perspective, and it makes you more versatile in dealing with things coming your way. So I think having been a veterinarian before really enriches what I do, and it has helped me significantly. Is it required? Oh, heck no. To be an osteopathic manual practitioner, I think going through the human practice program is imperative. I don't think you can develop the skills that you need otherwise in just an animal program. I think you could probably get about 50% of the work done that you needed to if you elected to go through a course that doesn't have any prerequisites. But this way it just makes me so much more effective, and I see this in my students coming through the animal program because I do teach that graduate diploma. I see how well they work in the field, and I understand that they don't have that background that I do, and yet they can be efficacious, and they can do a good job for their clients. They can be happy in their work, and they can feel confident in their work. So it's there's all education's worthwhile. What can I say? I'd be a dilettante. I'd be in school all the time if I could.
I completely agree with you on that, though, that no matter what background you come at something, the next thing with, you always find interesting ways where that previous background is applicable or can help you move forward and give you that unique perspective. Something I talk to students a lot about. No experience is a wasted experience, even if you don't enjoy it at the end of the day. It's funny how it does come in handy somewhere down the road for the most part, right?
It is shocking, some of those courses that you took, let me see, like introductory beekeeping. It's like I had no idea that would come in handy at any point, but it's a great conversation starter. So you'd be amazed at how you can connect with people through your own experiences. So
yeah. Very cool. So what is a typical day for you like then?
Oh, typical day for me is quite diverse. Apart from my teaching days, so I'll take those and put them over here because they're kind of separate from what I do. If I'm working in my human practice, I may have, and then thinking of kind of my pre-pandemic kind of day, I would have 18 to 20 appointments lined up for the day. Some of those appointments, I may have 2 or 3 dogs. I may have a cat thrown in there in amongst the humans. So you get this interesting diversity where you're working on a human body and then all of a sudden you're changing to a quadruped. So it gives you this real mental agility, and it also wakes your day up, right? Where things are not always the same. You've got some variety and something interesting going on, and quite frankly, therapeutic. As a veterinarian, I mean, my technicians always got the snuggle time. They always got to, I always did the pokey sharp things. They always got to have the hands on and, hey, how are you? So their endorphin levels were a lot better than mine. Now I get to handle the animals, right? So you get, it's a little self therapy as well. So it's good for your day that way. I try and schedule all of my farm animals or horses on days when I'm going to be out of the practice, because it's a little bit awkward, sticking a horse in the middle of a bunch of humans. So I will go out to farms, and depending where I'm going, I may have as many as 18 or 19 horses all in one location. I may travel from barn to barn. Along the way, funny enough, you'll have horses, you get some goats thrown in there, had some ducks, geese. We get cats and dogs thrown into the mix. And funny enough, some people, it's amazing how many times you're treating a horse and you're also treating the rider, because essentially they're a functional unit when they're working together. And if horses are amazing, because even when we don't realize it, they spend a lot of time trying to keep the human up. So even when they're being awkward, they're really manipulating their bodies and trying to hold us up and keep us from falling. And that puts a tremendous strain and toll on them. If the human is unbalanced, imagine if you habitually kind of lean to one side and you're kind of caught there, your horse has to compensate for that. So if I can take the human and straighten it up, the horse is much healthier and much happier. So treating the human actually indirectly treats the horse. So that's a really nifty component. So if you're not really keen on the idea of, oh, I don't want to work with people, just think about adjusting people to help the horse. That kind of makes it a little different thought process.
That makes sense.
Yeah.
So it's not really a typical 9 to 5, or is it, type of work?
Well, this is kind of magical, because in veterinary medicine, I had no typical 9 to 5 days. I was working, you finished when you were done, which might mean 11 o'clock at night, and then you were on call. And so you had this constant grind of work where you never really felt like you had downtime. And it was really hard to schedule anything that might relate to family, that might relate to recreation, holidays. Those were really difficult to schedule. Osteopathy is not an emergent procedure. It's something that you can do as a maintenance or prevention. You don't have to be out right now because an animal needs you. You can schedule it when you want to, pretty much. So I have a great quality of life now comparatively. I get to sleep all night. I do get to eat my meals. It's very exciting. Occasionally I can actually talk to people. It's also fun, uninterrupted. So I work far fewer hours than I used to, and quite frankly, I actually earn way more money than I used to, which is kind of a shocking statement. But so I have a double whammy. I've got more time off and I have more disposable income, so I'm a little more comfortable.
Awesome. Sounds great. And so you own your own business, your own practice. Is this a common thing for people working in animal osteopathy or osteopathy?
Osteopathy is predominantly self-owned. Like there's a lot of people who work on their own or work with partners. Like they may have a couple of people working with them. The way the industry or the profession kind of works is that most people are self-employed, and they're either renting space in a clinic or they're taking a percentage in a clinic, right? There's some kind of cost, some kind of sharing going on. And animal osteopathy is the same way. Animal osteopathy in Ontario is tiny. This is an emerging career. Okay, so there's like right now there are 8 people that actually have my credentials, not with the veterinary part in, but have human osteopathy with animal layered on. That number will rise exponentially as of the fall from 8 to 13. So there's going to be 5 more new graduates in Ontario, somewhere in other provinces. So it's a tiny, tiny field. So it's mostly self-employed, mostly people who are really on the forefront of a new therapeutic here in Ontario.
Okay, super interesting. And
Yeah, there's
finding
lots of room.
yeah, lots of room for growth, that's for sure.
Yeah.
So what was the learning curve like then for you starting your own business in this? What are some important things for students who are watching this video to keep in mind with regards to getting into this career, but also knowing that they are going to be kind of starting their own business and being entrepreneurs on top of embarking on this career?
Yeah, I think the rules that apply to all business apply to this profession, and that is have a really good lawyer, have a really good accountant, so that you have proper recommendations as to how to set your business up. Understand what incorporation is, because that's sometimes a key feature in this business to perhaps be incorporated. There are benefits for it that range from liability all the way to financial. So that's something you really need to investigate. You need to be social media savvy. So having a Facebook page, those types of things are helpful. You don't have to be aggressive in your marketing right now because this is a relatively new profession. And even in the human side, marketing is not a big issue beyond like web page, Facebook, that kind of thing. So you need to be ready for that. You also need to have a really good idea of what your ideal scene is. What do you want your business to look like? How many days a week do you want to work? Right? What kind of time commitments are you willing to make? And you kind of need to stick to your guns. Funny enough, this is one of those professions that is so in demand, although you don't hear about it when you start working. It's so in demand that you can get flooded. For instance, when I started working strictly as an osteopathic manual practitioner, I had a number in my head of how much I had to earn to cover my bills, to feel safe and like to feel like I had food security, that I had my home taken care of, that I could pay my bills and not worry. I hit that number in 3 months.
Wow.
Then I had my, oh wow, that's good number, which was, whew, yeah, I can plan a holiday. I'm going to be able to have extras. I can take care of, if I decide I want to buy a new car, it won't be a big deal. That number I hit within 6 months of graduating.
That's amazing.
It is amazing.
Wow.
It is. It's startling. If you are diligent in your work and you do a good job of your work, it will speak for itself. Word of mouth referrals are huge in this industry. It's going to keep you going. Of course, you want to be a member in good standing of the association, which in Ontario, OSTCAN, the OOA, is the association that we're part of, and it ensures that you have a billing number so that you are recognized by insurance, so that people can claim your services, at least on the human side. The animal osteopathy is not eligible for insurance coverage. So if people have insurance for their pets, osteopathy is not covered. It is when I do it because I'm a veterinarian, but it isn't when a non-veterinarian does it because it's not considered part of veterinary medicine. So
It's really
that's
good to know.
yeah, another little feature to have in mind. Exactly.
Okay, thank you. That's some really great perspective on what it takes to kind of run your own practice and all the ins and outs involved in doing that. Um, just curious, I feel like you've already somewhat answered this, but just to clarify for anyone that might be watching this and is wondering, can you practice animal osteopathy without touching the human side at all once you complete that animal training, or is that more difficult to do?
I believe you can do it. I think you need to be more patient in your expectations of how your practice is going to grow. So, for instance, with me, I'm doing both humans and animals. Well, human osteopathy is in high demand. Animal is almost unheard of. So, it's a growing demand. You have to educate. So, one of the things I find with my practice with that referral component is that a client that I'm treating on the human side will find out I do animals. They'll bring in their animal. Then all of a sudden their friend hears I'm treating so-and-so's dog. They'll bring their dog. Then they find out I'm treating humans and they come in. So it's a kind of a self-feeding kind of cycle. And the same thing happens in the horse side. So you lose out a bit of that momentum and a bit of that cross referral. So it's going to take you longer to develop a career, potentially, when you limit yourself to animals. Can you live off of animal only? Absolutely. Right now, again, with 2021 conditions, I'm not allowed to practice on the human side. I am living 100% off of my animal side. So I've only got 50% of my business functioning right now, and I'm secure. I'm feeling financially secure and safe. So I can do that. It just takes, like I said, a little bit more time and to build that momentum.
Wow, that's awesome. That sounds so good. And on that note, this was a later question, but I'll ask it now. Can you speak a little bit more to how your career and osteopathy has been impacted since COVID-19 and what you see kind of happening going forward as well?
Yeah, it's been problematic because osteopathy is not a regulated health profession like chiropractic or like massages. We come under the heading of personal services. So that means every single time we go into a significant lockdown, in the Ontario situation, gray lockdowns previously, and certainly stay-at-home orders, have negatively impacted my ability to work. So I haven't been able to work. That's been stressful. It's not stressful from the perspective of unlike restaurants, I feel for them. I don't have high overhead. I don't have a lot of rent to pay. I'm not buying any product that's going to go off. All of my cleaners and my masks are going to be good, so I know I can use them when I come back. So that part isn't a big deal. What is a big deal is the stress of having a full client roster. I'm basically full at least 2 weeks to a month out. So you're trying to call or contact 130 people to say, sorry, I can't get you in. I'll book you again when we open. And it's that on, off that's been really problematic. I think going forward, we're going to see, obviously, until we get the pandemic under control, I think we're going to see a lot of that on off. So that's a little emotionally stressful. I think, funny enough, I think the pandemic's going to be very good for alternative care therapies. Our medical system is bogged. Our healthcare providers are exhausted. There are going to be long-term repercussions for our healthcare. People are going to, when this all kind of slows down, I think you're going to see doctors and nurses all of a sudden just collapse because they're running on adrenaline and they've been doing it for a year. They're going to do it probably for another 8 months to a year, to kind of get the aftermath taken care of. And then they're going to be faced with the catch up of trying to take care of people who have been put on pause while we're dealing with these surges in the pandemic. And I think care providers like osteopathy and anybody else who's hands-on, whether we're talking massage or chiropractic, I think they're going to be integral to helping people, animals, move forward and stay healthy and manage their lives while we're getting everything else under control.
And I think to that point too, hopefully they'll be focusing a little bit more on taking care of themselves, right? For these healthcare professionals.
Yeah, I hope to see that, and I hope that we can be part of that process. I know myself, a lot of my human clients are emergency med, right? They're paramedics, they're firefighters, they're nurses. So we see a lot of those frontline healthcare workers, and we're supporting them because their bodies go through a heck of a lot of damage when they're trying to help people and move them around, and
Yeah,
it's very physical.
very interesting.
Yeah,
Are you hearing me okay? I just want to pause for a moment.
absolutely. Yeah.
I'm having a little bit of feedback on my end. So,
No worries, you're good.
so for anybody that's interested in learning a little bit more about the earning prospects and seeing, is there anywhere to see actual numbers or look up data, labor market data on the profession for somebody that wants to kind of back things up with numbers for themselves?
It's difficult. The best place to go at present for any information on classical osteopathy would be OSTCAN, OSTCAN. They're a national association for osteopathic manual practitioners. Here's the catch: there's nothing on animal osteopathy. There is absolutely nothing, and that's because it is new. We don't have data. We don't have a background to provide for people because our numbers are so small. Our goal is in the next couple of years to establish an association of our own to keep track of animal osteopathic practitioners so that we can then develop this kind of database where we can give feedback to people, help them understand just how this can fit into their lives, what they could do with it, what the earning potential is, quite frankly, from animal osteopathy. To put it bluntly, I mean, to throw a number out there, if people are interested, and I'm not shy about this, if you're working in animal osteopathy, keep in mind it's part-time for me right now. I can earn, 70, 80,000 in a year very easily and that's during pandemic conditions with animal osteopathy. So that's a doable thing. I do have students who have committed a lot of time to building their practice who are doing the same, as graduates. So from a non-database perspective, I can put that number out there, and the earning potential is quite high if you're willing to put the time in and be patient and just keep doing good work.
Thank you for sharing that. I'm sure many who will watch this will appreciate you sharing that.
Yeah, I think a lot of times we don't talk about numbers because we're all very like, don't talk about how much you earn. It's not polite. Well, you need to know when you're a student what you might anticipate. Am I getting into a job that's going to cap out at $40,000 a year, or can I get into something that really, honestly, you can earn as much as you want in osteopathy? It depends how much you want to work.
Yeah. Well, at the end of the day, we're all working to earn a living and support ourselves and families, right? So I'm with you on that. I feel like, as much as it's not as nice to ask the question, and I wouldn't ask you directly either, but at the same time, when I'm working with students, I try to emphasize it is important that you understand the numbers, because essentially you're planning your life based on this, and you need to know, how much will you be able to support yourself, your family, the people you love based on this type of career path. So thank you. I appreciate you sharing that perspective.
Oh, you're welcome.
What would you say is the best part of what you do?
Oh, the best part. Oh my gosh. Do I have to pick one thing that's the best part? Snap.
Feel free to mention a couple if you'd like.
Okay, good. So obviously the best part is that I'm hands-on with animals, right? So that's a fantastic thing. So I'm directly affecting the quality of life for a lot of animal patients, and I really appreciate that. I jokingly say to some of my clients, especially new ones who are curious about what I do, I said, well, basically, I've convinced you to let me have some therapy, like time with your horse, and you're paying me to do it. So it's kind of, and they laugh about that, but it's a really nice component that you are so hands-on with animals and you're directly affecting their life. So that is a fantastic thing. I'm probably a little weird for a veterinarian because I actually do like people, but I've always considered that people are animals too. So I guess that's why I kind of like them. And I think I'm affecting on the animal side. When I treat an animal, I'm also treating the human, because their quality of life goes up when their companion is feeling better. So that really influences the animal-human relationship, and I think that's an amazing place to play in, because you can have such a positive role on both sides. And I love the diversity. Right? Like no day is boring. Nothing is the same. There's always something new going on. There's always a new challenge. And the variety is infinite. So that's really appealing to me.
That's great. Thank you.
You're
And
welcome.
what would you say is the most challenging or difficult part?
Ooh, most difficult part. School. Keep in mind, I went back when I was in my late 40s, right? So mid to late 40s. So it was really different going back to intensive school at that age. So that was challenging. It's the challenging part is believing what your hands can do. there's that, again, that period of time when you start in any occupation where you doubt yourself, and it's really kind of mind bending to think, okay, just by doing what I did, feeling what I felt, that's going to have a positive effect. And so you have this little bit of a, am I really doing anything moment? But then you see the changes, and you realize that you've had a positive contribution. So I think that's a really challenging part as well.
Do you feel that that still happens, or are you kind of a
Oh,
lot
of
more
course.
confident now?
Oh, I'm a lot more confident, but I think that if I don't have a day where I doubt myself a little bit, I'm not really learning. Right? If I have that much arrogance that I think every day is going to be fine and I'm magic, I'm actually not really. I'm denying the truth. And I think it's really important that you do a lot of self-scrutiny and a self-reflection and say, did I do my best work today? Why didn't I? Was it the case? Was it me? Do I need to go do some more research? Because I still learn and I still go back to books and study and do all those things because you want to increase your competency, right? So you need to doubt yourself every day a little bit.
Yeah,
Just
that's a really good point. Okay, so there's a good reason why I always doubt myself every day.
Exactly.
Thank you for that.
Yeah, it's learning.
Yeah.
That's right.
But you're right? When you have those moments, I'm the same. I'll go and I'll look things up, or I'll ask more questions, because you're always striving, okay, maybe if I in fact could have handled that better, then what else can I do? And you're itching to kind of get more information and more resources. So that's actually, it is a good thing at the end of the day, right?
Absolutely. I think when you let that doubt hinder your progress, when you sink into self-doubt and say, oh, I'm no good at this, that's a different conversation that you're having with yourself. When you have self-doubt and go, ooh, I need to figure out why I'm not feeling comfortable or why I'm not getting the results, that's a different avenue, right? So one takes you into a very bad place where you don't progress. The other one gives you a chance to make changes and to actually develop.
Yeah, 100%. Thank you. That's a really good point. Really good conversation to have too, to talk about that a little bit.
Yeah.
It happens to everybody and it's not talked about as much. So
yeah, it happens everywhere. It doesn't matter what you do for a living.
yeah.
Yeah.
So, and what personal qualities or abilities do you think are really important? If you had to name 2 or 3, let's say, to be successful in this career, what would you say are absolute must-haves?
I think you have to have a high degree of curiosity. Like you need to have that ability to create inquiry in your mind where you're curious about why things are the way they are and you want to solve it. So maybe you want to be a little Sherlock Holmes, right? You want to solve a mystery. So that might be one aspect. I think another aspect is you have to have an interest in people in general, whether you're treating just animals or humans or a combination. You can't get away from the human. Remember, every single animal brings a human in with them. So you've got to have an ability to relate to that person in some way, shape, or form. Okay, so you've got to be ready to take on that social avenue. You don't have to be an extrovert. You can be a complete introvert. You just have to fake it normally when you get out and see people, right? Got to have that ability. And I think the last thing that you need is a little bit of, I don't know what the word I would use. I think you need to be a tad humble because it's really not you that's doing it. It's not me that's actually doing the work, like the healing. That's not happening. You're a facilitator of health. So you are actually creating structural change so that the animal or human can self-heal or self-regulate. So you need to keep that in mind and have a degree of humbleness about you so that you understand where the changes are actually coming from. Again, you're being a facilitator, which is a great place to be, but you're not the cause, you're not the be all and the end all. So you have to leave some of that ego behind.
Yeah, that's a really good point. And I never thought about it like that. And I think that's partially because I don't know as much about osteopathy yet as I could. But that's a really good point, recognizing that you are just facilitating, not just facilitating, but you're facilitating and you're making way, as you said, for that healing to happen.
Yeah, exactly. Exactly.
So for those who are still curious to learn or get involved in this career path or learn more about it before they kind of dive in, are there any other professional associations or groups or other areas that you would encourage them to get involved with or read from or gather information from? what can people do or get involved in? I know sometimes there's networking groups or professional associations or webinars or events or newsletters they can subscribe to. What do you find useful?
Well, yeah, this is the problem. Again, osteopathy is so new, right? Especially in the animal side. So there's really not a lot of resources out there. So I would suggest that if you are interested and you want to know more, that you get hold of the Canadian Academy of Osteopathy to start learning about the education process there. If you want to look at a type 2 school, there is, Canadian College of Osteopathy, CCO, is in Toronto. So that's, to be fair, I can't just plug the school I went to. You can have a look at their curriculum and see what they offer, because you really need to do the human side first. I don't think you're going to be good at this if you don't, right? There are courses in the States that will give you a chance to work on one species, and they'll take you either out of veterinary medicine. So if you're a technician or a veterinarian, and they'll take you out of the osteopathic side. So you've got to have training on one side or the other. And I would recommend the osteopathic training for sure. You can talk to OstCan, OSTCAN, go online to have a look at that. Have a look at the OOA as well, which is the Ontario Osteopathic Association. They can give you more information about the field. I would investigate the animals you want to work with, right? So going online and looking for, any kind of horse association in your area. If you want to work with dogs, you want to start checking out rescues. You want to look at breed associations, sport associations, agility associations, flyball, that kind of thing, and start to look at the industries that you want to work in and what they offer and where you think you might fit in. Get in touch with veterinary clinics,
Yeah.
because specialists in rehabilitation, see what they are doing and where they think this might land with them. Doing some research in your area to see what those avenues are. They're not going to know about osteopathy, by the way. They're not going to have a clue because it's not really that widespread. But feel free to contact the Canadian Academy of Osteopathy, because they can always fire stuff back to me, and I'd be happy to talk to people as well. So.
Awesome. Thank you. I think it's just interesting what you just said about veterinary clinics not having too much of an idea about it. I wonder if the day will ever come where, as an osteopath, you work for a veterinary clinic or office down the road. That would be very interesting.
That would be very interesting. And actually, funny enough, depending what province you're in, you kind of have to, because any handling or treatment of animals is considered veterinary medicine, that you have to actually work under the auspices of a veterinarian in order to be able to practice. So if you are in Quebec, you're going to have to work under a veterinarian. If you're in the Maritimes, you're going to have to work under a veterinarian. If you're in Ontario, you don't have to, because Ontario views non high risk procedures like massage, like osteopathy, as being non-veterinary medicine. So they really leave those alone. So every province has different rules. So there are cases where you would be working in conjunction potentially with veterinarians. So
it's important that anyone thinking about this career path also understands where they hope to work down the road and what the regulations around that would be. Thank you for bringing that out. It's really important.
Yeah, a little bit of a legal thing for sure. So you do need to consult with veterinary professions in your province.
All right. Well, thank you, Kate. This was so insightful. I really think that you're going to help a lot of students really better understand this career path and what they need to do to learn more about it. And I look forward to sharing this video with our students and alumni at the University of Guelph. So thank you for taking time out of your busy schedule and all of the chaos that's happening in and around this world today to answer some really insightful questions. I really appreciate it. And I wish you lots of success in your future, continued success, and looking forward to staying in touch. I am going to stop the recording now, and then maybe we can just stay on for a couple of minutes. So thank you again.
Thank you for having me. It's been great.